Good morning, good afternoon, and good evening, social marketers around the world. I'm Christine Jennings, and as webinar manager of the International Social Marketing Association, it is both my privilege and pleasure to introduce the 39th in a series of webinars designed to advance social marketing teaching, research, and practice. Our webinar today includes a panel of social marketers eager to talk about implications for social marketing in this time of COVID that can influence your work. I'm so pleased to see that we have webinar registrants from over 24 countries joining us today. We'll begin in just a minute, but before we do, I'd like to share some timely updates provided through the International Social Marketing Association and regional associations. I'm thrilled to announce that ISMA volunteers have been working really hard on a more robust website, and we recently launched this site, and I encourage you to check it out at isocialmarketing.org. We have a lot of COVID resources on the ISMA website. We have our own resources that have been collected through ISMA volunteers. And you'll also see that we have collected resources from a variety of our social marketing associations. We've included here, and you'll see on the site, that several of the associations have put together succinct recommendations and coronavirus statements on tackling the problem based on their collective knowledge and experience. The Pacific Northwest Social Marketing Association will be addressing COVID's environmental impact at their June quarterly forum. So be sure to check their website for more information on that soon. As we noticed in our registration, many of you joining today, this is your first ISMA webinar, so welcome. We have bi-monthly webinars featuring speakers and issues from around the world, and we offer these webinars jointly with our regional associations. Be sure to check out our next webinar, which is with SMANA, the Social Marketing Association of North America, and that's on June 10th. And registration's now open, and you can find that on the ISMA website. As we get ready to introduce today's panel, I'd like to encourage all of you to communicate with the webinar team using the chat box at the bottom. If you have any technical questions, you'll find that at the bottom of your Zoom screen. There you'll also notice a Q&A box, and certainly you'll have questions that you want to submit. Be sure it's really helpful if you use the Q&A box rather than the chat box to submit your questions. For today's webinar, we'll start with some introductory thoughts from each panelist. Then we'll answer some of the questions that you all submitted during registration. Because we've already received so many questions at registration, we're going to prioritize the questions that you've already submitted. But we will be saving a few moments at the end of the webinar to answer a couple of questions live. So if you have questions, please make sure that you submit those using the Q&A box. And then later in the webinar, we'll encourage you to start upvoting those questions using the little thumbs up sign so that we can take the most upvoted questions. So now I'm happy to introduce today's panel. Beatriz Casais is with us from Portugal. Sara is with us from Orlando, Florida in the US. Gael O'Sullivan is in Washington, DC in the US. And Mallory is with us from Spokane in Washington State in the US. We're so fortunate to have these social marketers share their insights with us today. Each of them, as I mentioned, has prepared some introductory thoughts to sort of get us thinking about the wide range of issues that we're all dealing with in this time of COVID. So first we'll hear from each of them, and then we'll answer some of the questions that you've submitted, and then take a couple of live questions. And this is our second webinar in this series so far, and the first one went really fast and lots of information. As you'll see, we're going to be covering a lot of information, so don't hesitate to add your questions, and we'll do our best to get to what we can live. But our panelists have been really helpful in agreeing to provide written answers to any questions that they can't get to today. So be sure to submit anything that comes to mind for you. So we're going to go ahead and get started, and we'll start with Gael. Gael O'Sullivan has shaped social marketing projects addressing pandemic threats such as avian influenza, She's worked in more than 40 countries addressing global health challenges. She's a founding board member of the ISMA and is currently at Georgetown University's Business for Impact program in the US. Welcome, Gael.
Thanks, Christine. Good morning, good afternoon, and good evening to you, wherever you are in the world. I'm going to very quickly frame this discussion with some high-level concepts. I only have a few minutes to cover a lot, so I'm happy to answer questions at the end or even after the webinar. The COVID-19 pandemic highlights the importance of public health and behavioral science approaches to contain and mitigate disease. In the absence of effective vaccines and treatments, the most powerful tools we have to prevent the spread of COVID-19 and reduce risk are voluntary behavior change measures at the individual level and social and cultural norm change at the societal level. Next slide, please. So let's acknowledge that behavior change is hard. Many people would prefer quick solutions such as medications or even surgery, as opposed to working every day to change their habits and lifestyles to improve health outcomes over time. Next slide. So let's unpack this a bit at the individual level. Human beings are messy when it comes to processing information, assessing risk, and making behavioral health decisions. We use mental models or heuristics to sort through all kinds of data, and many of our behavioral health decisions are made unconsciously. We are constantly toggling between tensions along several dimensions, as you can see here on this slide. Next slide. At the community and societal level, it can take decades for norms to change. Often change is incremental, and eventually we come to a tipping point where all of a sudden collective public opinion has shifted and associated policies and laws create a new normal. Because of the COVID-19 crisis, we're being asked to do a lot of things differently, immediately, and to make these changes at scale. Adding to this challenge is the very confusing guidance and mixed messages we have seen here in the US from our federal government, state and local governments, public health experts, and private sector businesses. New behaviors include wearing a mask in public, which most Americans have never done before. Next slide. We're also being asked to adapt previous cultural traditions and behaviors, such as shaking hands, and to adopt safer behaviors, such as bumping elbows. Next slide. When possible, it's extremely effective to design visual and physical cues to specifically show people what they should be doing. A physically distancing nudge, such as this one, is a good example. And note that I said physical distancing. What we should not be doing now is social distancing, in that we need to be there to support each other emotionally as we go through this very stressful time. Next slide. While we like to think that we make our behavioral health decisions based on facts and logic, again, it's much more messy than that. And we tend to make decisions as a function of perceived peer approval and other social benefits. A couple of terms here are particularly relevant for COVID-19. Descriptive norms refer to our observations of how people actually behave in our daily lives. Injunctive norms are your perceptions of how things ought to be, or your perceptions of what is or is not socially acceptable. So this concept reflects your own personal values. Next slide. Just a quick plug here for this book written by my Georgetown colleague, Leslie Crutchfield. Leslie analyzed a number of social movements to identify common factors and best practices that helped get them to that tipping point of broad social norm change. So if you want to learn more about norms and movements, you might want to read this book. Next slide. So just a couple of last slides to bring this back to behavioral science and social marketing. There are many useful change theories, models, and frameworks to inform our work, but here are a few that I find especially relevant for COVID-19. The first is the extended parallel process model, often used in pandemics, because this model breaks down how behavior change happens in this type of emergency situation. There are two sets of factors that have to work together to cause behavior change. On one hand, an individual has to perceive the threat as severe and also has to feel that they are very much at risk personally. On the other hand, the individual has to believe that there are effective responses available and that they themselves can do something to reduce their risk. The socio-ecological framework helps you understand the spheres of influence that can impact an individual's health behavior and can inform a multi-channel strategy to ensure a holistic approach. There are many behavioral science principles from the broader literature that we see playing out with COVID-19, but given the time, I'll just mention a couple of them here. The Dunning-Kruger effect. This explains why your cousin Kenny is an instant expert on the pandemic. People often overestimate their level of knowledge and expertise on a particular topic, especially in a situation with many unknowns. Anchoring. This explains how you can manipulate expectations about what is normal when you pick an arbitrary endpoint and then debate or negotiate from there. We have seen the US president use this technique in trying to set as a so-called normal endpoint the prediction that 200,000 Americans would die from COVID-19, so that if in fact only 100,000 die, this will look like a success. Next slide. So how does all of this relate to social marketing? Social marketing offers many important concepts for the COVID-19 pandemic. First, the pandemic reiterates the importance of understanding your audience and segmenting by different variables. A recent message test in the US showed, for example, that different messages worked in different geographic regions of the country to motivate people to comply with public health measures. Second, the 4 Ps framework helps us think through different dimensions of the marketing mix that have to work together to drive change. And I'd add a 5th P for policy, since so much of the pandemic response relies on having appropriate policies in place. Third, marketing and social marketing use exchange theory to consider how to frame the offer, whether it's a product, service, or behavior, in relation to perceived barriers and benefits. And lastly, we like to say that successful social marketing efforts make the desired behavior change fun, easy, and popular. Next slide. I'll leave you with one more behavioral science principle that helps explain the seeming irrational behavior of buying out all the toilet paper in the store. Zero risk bias posits that we'd rather eliminate one category of risk, even if that puts us at greater risk overall. People are often inherently selfish in a threatening situation, and we also imitate each other's behavior. So once you see empty shelves, you want to stock up on toilet paper too. Next slide. In the interest of time, we are not going to play this video, but we will send the link around afterwards. It's a great, hilarious, but also serious compilation of all of the many mixed messages out there to try and guide the public in behavioral decisions. Thanks.
Thanks, Gail. Next, Sara Isaac will be exploring the challenges and opportunities for behavior change as COVID-19 upends social norms and behavioral habits across the world, including its impact on climate action. Sara founded a climate action coalition that successfully pushed for a local commitment to 100% renewable energy, and her work was recently featured in a National Geographic documentary. Sara also edits and writes for the funeasypopular.com behavior change blog. She is my colleague and a principal at Marketing for Change in the US. Welcome, Sara.
Thank you, Christine. We can just jump to the next slide. And just a moment. Here we go. So I'm going to be talking a little bit today about the opportunities and the challenges for climate action during the pandemic. So as this amazing before and after picture from New Delhi shows, a key climate lesson from COVID-19 is that change is possible. We can, as a collective world, dramatically reduce emissions of greenhouse gases. Obviously, with a global economy powered primarily by fossil fuels, this is not sustainable. But it proves that the havoc we are wreaking on our planet is a choice we are making. Next slide. COVID-19 has forced us to take a planet break, but history tells us that this is unlikely to continue. This graph of world energy consumption shows dips from previous economic downturns, including the 2008 global financial crisis. It also shows how recovery led to even higher levels of fossil fuel consumption. Next slide. As we think about how to incorporate climate action into conversations around rebuilding our economies post-COVID-19, I hope we will do less of this. This is a beautiful award-winning ad, but I believe this often popular gloom and doom approach can inadvertently suppress climate action. First, it fails to build a sense of urgency and self-efficacy. How can any one person stop climate change? Second, it ignores present bias, placing the risk far in the future. So they are scary, but not urgent. And third, anytime you give people an overwhelming problem, but don't give them skills and tools to act, you can provoke the ostrich effect, a human bias to stick your head in the sand and pretend the problem doesn't exist. Essentially, it violates the models that Gael talked about, the need for the extended parallel process for both efficacy and skills and knowledge to act. Next slide. What I love about Drawdown, both the book and this website, is that it provides evidence-based solutions for impactful climate action. But it is developed primarily for experts and some very engaged climate activists, including myself, who's read it but still does not know all the details. Next slide. So how can we fit climate solutions into the lives of ordinary people living through an extraordinary time, like these commuters returning to work in Milan last week? How do we make climate action relevant and salient for people trying to return to some sense of normalcy in a time of great uncertainty? Next slide. These are 4 key opportunities that I see for climate action during this pandemic. First, it has never been more clear that we are all in this together. Climate, like the coronavirus, is a global threat. Second, COVID-19 shows us how much we are willing to do to protect both personal and public health. Climate change is already affecting health in communities across the globe. We need to make those health impacts more visible and more salient. Third, for both COVID-19 and climate, communities are very often the locus of change. As a politician I know in my hometown likes to say, potholes are not political. Policymakers who see community impacts up close are more likely to act. And fourth, in times of transition, people are more open to adopting new behaviors. If we act quickly, we can help promote and build on climate-friendly behaviors like cooking at home, recycling, composting, and conserving energy, which my agency's Parent Normal Survey shows is increasing across the United States as families shelter in place. Next slide. But behavior change isn't easy, and neither is climate action. Here are 3 key challenges that I see for continuing to demand climate action in the time of the pandemic. First is pent-up demand. Flight reservations are already picking up as airlines relax cancellation restrictions and advertise deals. People are anxious to get back to normal, which will mean normal energy consumption unless we act now. Second, who gets stimulus money? Governments across the globe are investing in unprecedented economic stimulus packages. Fossil fuel heavy industries are likely to be first in line, much like they were after the 2008 downturn. Third, the global economic downturn may overshadow the urgency for climate action. Although some people do call climate change COVID in slow motion, climate change may struggle to gain the attention of citizens and policymakers during this time of great uncertainty and upheaval. Next slide. I'll wrap up with 4 ways I think we can use our social marketing skills to build back better. First is make it about now. Increase urgency by showing how fossil fuel emissions and climate change are harming humans in the present. Second, make it about health. Climate change is already impacting health in many ways. The link between air pollution and the risk of dying of COVID-19 is just one example. Third, make it about community resiliency. It really is about building back better rather than returning to a not so great norm. It's about creating a better future rather than just preventing disaster. And lastly, I'd love to see us work to redefine abundance. Climate action is often equated to giving up things we love. I don't think we can ask people to sacrifice more right now, but I do think we can help redefine abundance in more eco-friendly ways. Next slide. Thank you so much. I look forward to your questions and comments, and I'll turn it over to our next panelist.
Great, thanks so much, Sara. Beatriz Casais is currently conducting research on both health and social marketing related to COVID-19. Formerly as a social marketing communication manager for the Portuguese government, she led HIV prevention media campaigns and policy. She is the assistant professor of marketing and strategy at the University of Minho in Portugal. Welcome, Beatriz.
Hi, good afternoon from Portugal. Hi, everybody. And thank you for inviting me to share my ideas about social marketing and how it can be used in this pandemic context. Well, as it was mentioned, before becoming an academic in this field, I was a social marketing practitioner in the prevention of HIV and AIDS, which is a topic with several similarities with the situation we are facing at the moment. I mean, the severity of disease, the sense of vulnerability, and the need to promote protective behaviors, particularly a barrier object like nowadays the face mask, that we can compare with a condom in the case of HIV prevention. So the difficult task is, in this way, is to communicate a consistent risk conscious in order to get a consistent behavior response. That risk conscious is one of the biggest challenges in social marketing when it breaks family contacts and affects emotions. In the case of HIV, there was also that barrier in social marketing that was the conscious of trust in someone when to decide whether or not to wear a condom. And now that we have to wear a face mask, there is also the same feeling when contacting with friends and family. It is different from wearing it in the grocery store or in public transportation with unknown people. So my first advice for social marketing practitioners at the moment is to focus on risk conscious in the new normality that we are going to face after lockdown. Until now, most people have been protected at home in self-isolation. That is not happen anymore, so now it is time to promote a protective behavior standard under a real risk conscious that cannot be based on trusts or not. Well, I would like to introduce my perspective with a specific model very useful in health-related social marketing. It's the health belief model. It allows to understand why people respond differently to social marketing intervention and helps to understand the best practices to promote behavior change. First of all, social marketers have to understand that behavior change does not occur because of a single outdoor or a TV advertisement or a social media campaign. Citizens' behavior change occurs when individual really understands a threat, like Gael mentioned, the extended parallel process model. So we need to make people really understand the problem, the risks, the severity, and how we can protect ourselves and the others. This means that social marketing requires an exchange process between a benefit and the cost of changing, and individuals have to find in the benefit a value that makes worthy the cost of changing, making physical distance or wearing a face mask the new social norm. It's hard, it's uncomfortable, the desire to hug friends and family is huge, and social marketing has to hack into that cost versus benefit of behavior change. First, people behave differently through demographic and psychological characteristics. That is why audience research and segmentation is an important social marketing strategy. It is mandatory to find out behavior clusters in population and conduct targeted interventions. The regulation should be universal, equal for all, but the communication should be targeted. Then behavior change also comes from the sense of vulnerability and the perceived severity and self-efficacy to change. The sense of vulnerability for elderly population, for example, contributed for an initial protective behavior, particularly here in Europe, that has a high proportion of senior population. On the contrary, some other countries took different public policies, considering the partial vulnerability of population. Well, but besides the public policy discussion, we have to understand that the sense of vulnerability or not may explain citizens' response to social marketing. For example, the relaxation of preventive behaviors by young and mid-age generation. Social marketers should pay attention to that. Next slide, please. Regarding the perceived severity, we could say that in the case of Portugal, where I come from, preventive behaviors against COVID-19 were taken easily after a contagious effect of international news, showing the severity of disease in Italy and Spain and France. For that reason, citizens took a proactive attitude, looking for voluntary lockdown even before the formal state of emergency. That is happening now. Now the severity of disease fortunately did not take the worst scenario here in Portugal, fortunately, and the consequence is to go back to normality with more relaxing practices, because indeed it was not so bad as they were saying. In fact, we closed ourselves at home very soon, and it was the best thing we could do, of course, with a big economic bill to pay. But this proactive response in social marketing is essential to prevent a disease. But at the same time, the consequences, the later mistrust in its severity, although we have the example of HIV prevention that had, unfortunately, a reactive response as reported in the literature. Next slide, please. Finally, I just would like to mention that an important condition to promote behavior change is the involvement of the whole community. And in the case of COVID-19, we observed a quick response from both the governmental sector and also the private sector, celebrities and digital influencers adopting the claim #StayAtHome. That prompt engagement with a claim promoted in a few days a social norm for lockdown, and people quickly adopted that norm. In Portugal, without being under an authority of stricter regulations, people really stayed at home. Now that we are coming back to a new normality, the social norm has to be wearing a face mask, and that is the new social marketing challenge. It is uncomfortable, out of the fashion standards, and a real barrier to express emotions and affections. So I believe it will be hard to promote the face masks and physical distance after the severity and vulnerability conceals in the drop of the epidemic curve. Regulations, in this case, is part of the policy part of social marketing, will be important tools in social marketing to create a desired social norm, as well as the nudge interventions, where the desired behavior becomes the norm. So, well, these were the notes that I would like to mention, and I believe that our audience today may have questions to promote a deeper discussion about this topic. Thank you.
Thank you, Beatriz. Next, Mallory Peak is leading COVID-19 strategic communication efforts for private and public health clients in the US. She brings her social marketing experience to discuss COVID-19's impact to issues such as substance abuse, violence prevention, and mental health. She is a senior account director at DH in the US. Welcome, Mallory.
Great, thank you, Christine. So I'm based in Washington State, and with COVID-19, our state had some of the earliest cases in the US, and we had to respond quickly and independently. And unlike other states in the US, our response has been highly effective in a lot of ways. Our team at DH, we're a communications agency here in Washington. We work with the Washington State Healthcare Authority, along with school districts, large hospital systems. Our state also has 29 federally recognized tribes that have their own governments and own COVID-19 response. So there's a lot of coordination with communities in our state. But today I want to share how to continue social marketing programs and address the motivations and barriers in the process. Next slide, please. So right now, the theme underlying all of our work has been simply, how do we support each other right now? Next slide. And the biggest thing that we can do in times of adversity is to make space for good things. And that means we look for opportunities to be helpful, to remove barriers, to go first with a solution to a problem, to share factual information, to lean into the role of trusted message carrier, to curate content based in research that's matter of fact, that's accessible, and to promote empathy, weaving empathy for what people are experiencing into all areas of programming and communication, and anticipating not just barriers and motivations, but the struggle that many in our communities are facing, especially when it's hard. And I want to share a few concrete examples of how our team has tackled some challenging topics right now. Next slide. So we oversee our state's opioid prevention campaign, and we know that in times of isolation, substance use can go up, and a big focus for preventing misuse and a big focus in opioid prevention is preventing misuse of prescription medications, of pain medications. So April 25th is National Take Back Day in the US, where people across the country return medication to take back sites and have awareness events. And last year, just to give you an idea, our state collected over 9,000 pounds, that's 4,000 kilos of medication. And because of concerns around COVID, all events were canceled. So our team pivoted very quickly. We revisited our strategy and looked at how we could help keep people safe. And we did things like promote a locator tool to find permanent take-back sites that were operating year-round. We asked for a commitment to lock up medication today as a prevention measure while people are homebound. And we encourage protective behaviors that could also support people through times of isolation, things like healthy activities to do with your family, self-care activities, and also ways to bring a sense of community virtually. Next slide. And as information nationally is politicized, as rumors circulate, we've seen a lot more pressure on local organizations to interpret information for their community. And school districts especially have a direct line to parents and caregivers and have been carrying a lot of the burden of information and direction. So this is just the homepage for the Spokane school district where I live. And the first thing you see is a pop-up with the most sought after information, from school closures to laptop distribution to ways to volunteer and help. And this is a simple thing, but leaning into that role as a trusted message carrier in your community and using that position to share factual information is so important, even if that's not your primary responsibility. Next slide. And our last big takeaway is promoting empathy at all levels. So working with a large children's hospital in our state, they quickly noticed an increase in children with injuries. And the concern around child abuse right now is very high in our country. We also know that parents are facing significant economic and emotional stress of their own. So we approach this topic with empathy. Next slide. We shared tips for families on managing stress, and we encourage networks to do the same. And we really needed to make space and acknowledge that the parents are going through a lot of stress, and that there's a lot of pressure on parents right now, and that it's okay to reach out for help. And in all materials, we also included signs of abuse and emergency numbers, but leading with empathy, especially when it's hard, when it's a challenging situation, when stakes are really high, is so critical. So we're moving from, next slide, please. So we're moving from just this understanding that at the end of the day, we're all doing the best with what we have. And moving from that place, we've found is just the key to addressing barriers and motivations effectively right now. So thank you.
Thanks so much, Mallory. So now as we head into the second half of our webinar, we're going to take some time and answer the questions, some of the questions that were submitted when you registered. So let's start with this idea of some of the preventative behaviors that we've been talking about. There was a question about motivation and how do we motivate people to respect staying away by 6 feet, motivate them to wear masks, motivate them to stay home. Any thoughts on that from a motivation perspective? Gail.
Yeah, I mentioned in my presentation a recent message test that showed different responses or different messages worked better in different geographic areas of the United States. And one of the findings that surprised me was, given how Americans are usually described as a very sort of individualistic culture, it's always me versus we. The messages that worked the best in the test were ones that actually appealed to the more altruistic side of our nature, to appeal to our sense to want to protect others and do this out of a sense of duty to be a good citizen. So I thought that was interesting.
And I'll just add to that, Christine. Which is that the social norms that Gail showed, the nudges with the markers that show where you don't stand, where you go. Those are super important for describing what's expected, which is that injunctive norm, and that helps people follow. And social norms, as always, are very powerful.
Great. Beatriz.
Yeah, as I mentioned, what I think is important is to go further the trust thing about trusting or not on the others. Besides the altruistic topic that Gail mentioned, it is important to get a consistent behavior on using or wearing masks, because sometimes people tend to think, well, with someone that is strange, when I'm in a public transportation, I have to wear a mask. But when I'm having dinner with someone from my family or friends, well, I trust on those people and I don't need to wear a mask. So I think that the social marketing message has to go on. It is not a thing of trust or mistrust, but a new social norm that can be helped also with partnerships with fashion, for example, and becomes face masks more than a simple protective equipment, but becoming it a fashion accessory, and to build partnerships with other agents that helps creating a social norms of wearing face masks.
Thanks.
Christine, I just have one comment just to kind of piggyback. There are two things that came to mind for me. One was really personalizing altruism, I think has been really effective in our context. You know, not just this will make an impact on, you know, our country, but more, you know, this wearing a mask or physical distancing will help protect your grandmother, will help protect your neighbors, and really getting people to think about, especially those who may be more vulnerable to the illness in their lives. The other is really those wraparound sort of norming cues from kind of physical markers to also sort of cultural activities around mask wearing or making masks or showing support through masks. We've even seen even just smaller things like, for instance, in the private sector, companies editing their mascots to be wearing masks, editing their logos that include characters or people wearing masks. And I think all of those little things work together to send a message that this is normal and that we're all doing this.
Great. One of the topics that came up is this idea that social marketing practitioners often are relying on interacting with their audiences digitally or online, and as well as in person. So in particularly community-focused efforts where you're engaging in person. Any thoughts about how practitioners can continue effectively engaging their audiences in person, or when they have limitations on doing that in person in a time of COVID? Beatriz.
Yeah, of course, social marketing has to be done in a community approach and a closed in an approach very close to with the community. So it has to be in person, but also using the digital media and digital media that can be targeted with a specific community with a specific message, because it is not worth it to have one whole message for everybody. We have to understand different clusters of population, to know the particularities of each community, and to think about a specific message that is considering the specific context that what that community is facing. I mean that people in health professionals, educators, different professions face different difficulties, and the social marketing message has to be talking to the different communities and the different requirements. So I would say that we can't have one message fitting all. We have to target different communities and segmenting different communities and developing different messages well, different communication, digital or in person, to face the different needs.
Thanks. Changing topics a little bit, there's a question about how many of us are dealing with the context of misinformation and fake news around COVID-19 in particular, and the drastic impact that that's having on trying to get people access to correct, simple, clear communication about what they should be doing urgently right now. Any thoughts about how social marketing can help counter the wave of that misinformation? Sara, and then Gael.
Sure. So I think one key thing is what you said, simple, clear. This is a time of enormous information overload, and people are struggling to absorb information and sometimes focusing on wrong information that they've purposely been focused to. So clear communications around mask wearing, for example. Can you show pictures instead of a long thread of exactly how you wear it? In my own community, because masks are not a norm, I see people wearing them on their chin or taking them off to talk. So defeating the whole purpose of wearing the mask anyway. And then in fact, using it kind of like a talisman, like if I have a mask with me, I'm protected. And so then maybe relaxing more about social distancing or washing your hands. So I think part of it is making our communications super clear. And then of course, it's using the trusted messenger. Right now in our country, those are our healthcare professionals. They are highly trusted, nurses especially actually, but also doctors and public health officials. And then secondarily, local government officials tend to be more trusted at this point than at our federal level.
Gael?
Yeah, I totally agree. And building on that, I mentioned last night a survey that Porter Novelli has been doing over the last few months to track changes in public opinion here in the US around COVID-19. And their third wave, which came out last week, shows a serious decline in trust among Americans at the federal government level. It's down to 14% of Americans who trust the federal government on this issue, and much higher numbers for local government. I think in terms of the disinformation and sort of rumors and myths that are flying around, social media is truly a viral vector for this. And Twitter and Facebook are announcing new measures almost every day to try and now catch that content and flag it. Twitter announced yesterday that you're going to get a notification every time you share that kind of information. We at Georgetown have a number of COVID-19 experts from different angles that we are making available to the media. We're getting our colleagues onto CNN, MSNBC, Fox News, as many of these big platforms as we can to try and get credible, trusted, factual information out there. And there was a great article in Forbes magazine last week about all of the disinformation, and it was spurred by the new clip that's been circulating called Plandemic, which is full of all kinds of incorrect conspiracy theory type information. And the author, I can share the link after this, does a really nice job of giving us practical tips for how, when your grandmother, for example, sends you the link to that video, how you should respond. And of course, it's not in anger. It's not using judgmental terms like stupid, but she gives a lot of really practical tips for how to actually have a conversation with people to help them understand what's factual and what's not. And it really starts from a shared value idea of start with the fact that you're family members and you love each other, and then kind of branch out from there to have a conversation to try and get people to realize sort of what's true and what's not.
That's great, Gail. We'd love to update your slides to include that link that we'll post on the site. There's a question about equity issues, and Sara, you touched on this a little bit. What about many of these equity issues across the board that have been longstanding in our countries long before COVID? Any additional thoughts around that?
So the inequities have always existed, and especially I'm most familiar in the United States, but it's exposed in terms of who has to work, so who is most at risk, who is first to be laid off, how there's not unemployment available. And one of the things that we've been doing as social marketers at Marketing for Change is helping our clients who have been working on those issues think about the implications in the time of COVID-19. So an example is we have a client who works with the Harvard Achievement Gap Initiative. One of the things that I'm very, very, very worried about is the achievement gap, which is also huge in terms of learning achievement in the United States, which is completely tracks with socioeconomic demographics, is going to explode. Wealthier children have access to technology, they have access to college-educated parents who can tutor them, and they have access to better learning, distance learning. And there's, in Orlando where I live, there's a huge cohort of students who are not turning up at all for the distance learning. So we are especially working on the 0 to 3, which is a time of where 85% of brain development happens. And our client, the Basics, has a great model. They call it rooted in public health, which it is. It's rooted in the socio-ecological model, so trying to have it everywhere in the community. It's also linked to the idea of making it easy, which is very much an important thing that we in social marketers do. Never underestimate the power of making something easier to understand or easier to do. And so they have 5 pillars that any parent can do. And what we did is we just added that extra piece of making it very accessible to parents now with a mobile friendly website that we're pushing out very rapidly with their information. Because to me, I think you could make a marker right now and you could track 20 years down the road, and you're going to see the effect of COVID-19 on the lives of these children who are not getting learning right now for a long time to come.
Thanks, Sara. Our hour is going by very quickly, my goodness. I want to ask all of you if you have any questions, please use the Q&A box to submit any final questions. And if you see other questions that you'd like us to take live, we'll only have time to take 1 or 2 live here in our last few minutes. So use the little thumbs up to upvote that, and we will try to answer our top questions live as we come in for the end. We also want to hear your questions because our panelists have agreed to provide written answers to anything following the webinar that we were not able to get to live, and that list is growing. So one more question on just really changing topics here. There's been discussion and questions about, we have social marketing practitioners who are not feeling like the projects that they work on are specific to COVID-19, and they're curious about the process of deciding whether or not to move forward with certain marketing projects during this time.
I don't want to, please feel free to raise your hand, anybody else, if you want to jump in. It's very rare that social marketing is working on something that's not important. And COVID-19 is an opportunity to see how the impacts, for example, let's just take recycling, which seems like such a small thing right now, or cooking at home, which has both food waste, so environmental impacts, as well as health impacts. Those seem small, but in time of COVID-19, there's actually opportunities. I mentioned the research we've done that shows that families are already doing this more at home. So how can we build on those new habits, or how can we build on this time of transition? Any time of transition, people are more open to new ways of doing things. And COVID-19, yes, we need to focus on this crisis, but when we come out of it two years from now, the same things that you're working on will either be there or they'll be worse. So I think it's not an either or. It's where is the piece that where are the opportunities that within this pandemic to keep these important issues moving forward.
Great, Mallory, and then Beatriz, quick thoughts.
Yeah, that's a great point, Sarah. And I just wanted to add, looking for opportunities right now where behavior change programs are mutually supportive, I think is really helpful and not detracting from the work around COVID protective behaviors. And that's something that we've seen in substance use, especially knowing that the rates of substance use are going up in our state, that people are vulnerable. We've seen that with mental health promotion and interventions. In our country, we've seen an 800% increase of people calling suicide prevention hotlines. So we also know that our communities are looking for help and support around those issues. So one thing that's been effective for us is looking for ways to partner with COVID-related service delivery that helps meet common goals.
Great.
Well, I would like to reinforce the idea that we don't have COVID-19 and the other issues in separate points. In fact, COVID is a problem that affects all the society and all the topics of society. The hidden inequalities that we have in society emerge from the COVID-19 problem. I would say the digital inequalities, the education inequalities, the health inequalities. So we have to reinforce, it is time to reinforce health systems and the education systems and the digital transformation in the society, and also the environmental issues that was mentioned before, the problems of poverty and domestic violence. I would say that all these problems in society emerge from an even dimension to what is really happening at the moment, also reinforced because of the COVID problem. So I don't think we have opposite topics in social marketing, but COVID came all the social problems even more important than before.
Great, thanks. I'm going to try to squeeze in two final questions, and these are a lot to cover in a short amount of time, so we'll try to do better in more time and more thoughtfulness with a written answer to this. Sara, you gave a couple of examples of specific ways that social marketing is helping during the pandemic, as did you, Mallory and Beatriz. Does anybody have any other quick, concrete examples to answer Jose's question of broader social marketing campaigns during pandemics? Anything that we could be sure to include on the website or direct folks to after this? Gail?
I wish I had those examples. I think what we have is a huge amount of examples of what not to do, and that's very instructive as well. And I hope that as a community, we will take time once the crisis has subsided to really learn from this. We saw the same exact thing when the Ebola pandemic happened. And one of my frustrations is, again, as a community, why are we not learning from what has come before? We know what's going to happen in these situations, but yet we see the same mistakes, whether it's communication strategies, behavior change, social marketing, whatever. People who in earnest are trying to do well, but they don't have the right training and background, and they're actually making things worse with the communication campaigns that they're running. So I wish I had examples. If anyone has any out there that are working, that are following best practices, please do share them, but let's learn from all the things that are not working too.
Another question from Kelly Dennings, and she says, during this time, it's hard to do social marketing well, yet quickly. It's hard to do it quickly in the best of times. What advice or examples do the speakers have for rapid research and intervention piloting during a crisis like this? Mallory.
Yeah, so one good example of social marketing and just broad communication strategy around the pandemic, and I'm biased, but I would say Washington State. I would, as a reference for people who are struggling with COVID messaging, I would just recommend going to coronavirus.wa.gov. just to see how our state government and all of our agencies have collaborated to make sure that we're bringing factual information to people, and also the materials that we've developed to inform the public around protective behaviors, around regulations that have changed, and also to prepare community partners, local governments to support that messaging in a coordinated way. That effort had to turn around very quickly, and we didn't necessarily have other states or other countries to follow at the time. I think one thing that was effective is looking at information that's widely available. We have a lot of private marketing firms and research firms that are sharing information in a way that we haven't seen before. And so I think there's a lot of opportunity to find more kind of secondary resources to support quick planning. One thing I would say is it's such a challenge right now to go through the social marketing process as we normally would, as we feel compelled that we need to, that we know is effective. But there are also resources. I wouldn't want to shut anyone down and feel that you can't complete social marketing projects or take a social marketing approach or use that philosophy in a quick way. But you have to just be open to that being imperfect.
Thanks, Mallory. Gail, a quick final thought.
Yeah, going back to the Ebola experience, this was 5 or 6 years ago already, but most of the world are very heavy users of WhatsApp. I know in the US we don't tend to use it as much, but in Sierra Leone, BBC Media Action did some research and found out that people were just so paralyzed by fear that they didn't know what to do. They weren't making plans for how to deal with Ebola if somebody in their family fell sick, etc. So they had this opt-in WhatsApp group where people got into this WhatsApp group and they used radio drama and WhatsApp together to create this character who was all about making a plan. And they had songs and they had concrete steps. And it took off like wildfire, and thousands of people joined this WhatsApp group. And so it was a really great way to sort of crowdsource in real time what was going on at the community level in a country, again, with very poor infrastructure. Radio and mobile phones are by far the biggest mass media channels available. But it was a great example of how to pivot in a crisis situation to figure out what the barriers were for your audience to be behaving the way they should to protect themselves and their families, and then using what we know are best practices with entertainment approaches and songs and giving advice in a way that people could remember it and they felt supported through a big social group.
Thanks so much, Gail. And thanks to all of our panelists. I'm going to conclude this part of our webinar and ask everyone to just stay with us for the last couple of minutes. I want to thank all of you for your time today. You've put in a lot of planning time for this webinar. And I also really appreciate your willingness to jump in and help us in putting the webinar together to provide some social marketing guidance during what is a difficult, challenging time for all of us. And I'm sure that this is, you're busy working on COVID issues yourself. So thank you to all of our panelists today. As I mentioned earlier, today's webinar, the recorded webinar, as well as the downloadable PowerPoint, will be posted as part of our webinar archive on the ISMA website. It will also be available in our COVID resources section. I'd like to invite those of you who joined today's free webinar to become a member of the International Social Marketing Association. When you join the ISMA, you also become a member of your regional association. You'll be part of a network of hundreds of social marketers, like our panelists today, and have access to a broader set of professional development materials, discounts to conferences, and access to 39 of our recorded and archived webinars. Be sure to visit the ISMA website for details about the June webinar that I mentioned earlier. That's with SMANA. And I also want to give a quick reminder to many of the questions today asking about resources and examples. Our partner and regional association, the Social Marketing Association of North America, has a really incredible and robust list of examples that can answer a lot of those questions. And the ISMA website has assembled resources from all of our regional associations. So you'll be able to find so much more there, as well as the written answers that we'll be putting together and providing following this webinar. I'd also like to thank Dave Cutter, who has been behind the scenes as our technical host today, handling all of the important work that helps us run this very well as the wider volunteer team who has done so much work in helping to organize these webinars. Panelists, thanks again. Really appreciate you and hope that you all will be available for a future webinar for the ISMA. And to all of our association members joining us today and participants in today's webinar, thank you for your continued support and participation. We hope to see you at our next webinar in June. This is the International Social Marketing Association, and we now conclude today's webinar. Thank you.